Ladies and gentlemen, Gamadum Benzies, greetings and thank you so much for joining us this afternoon for the second installment of the Tribal Governments in Action Forum. In this series, the National Congress of American Indians is showcasing the many innovative and forward-thinking approaches that tribal governments are deploying in response to the COVID-19 pandemic. My name is Licia Maddox, citizen of the Quechan Indian Nation and Vice President of External Affairs at NCAI. I will serve as your moderator today. We are honored to have 4 tribal leaders here with us today. The leaders are from the Menominee Indian Tribe of Wisconsin, the Shinnecock Indian Nation, the Yurok Tribe, and Pueblo of Poake. After each leader tells their story, we will begin taking your questions. To submit your questions, please use the chat function at any time during the forum. Without further delay, I'd like to turn the floor over to Chairwoman Joan Delabrew of the Menominee Tribe of Wisconsin. Chairwoman Delabrew, the floor is yours.
Hoso, and good day to everyone. I appreciate this opportunity that was afforded so that we could reach out to other tribes and find out, from my perspective, what they're doing. As the moderator indicated, I am the current chairperson for Menominee Indian Tribe of Wisconsin, which is located pretty much center of the state of Wisconsin. We're known for our forestry, world renowned, and that our borders are very visible. Should you want to do a Google search, you'll be able to clearly find us by our forest outline. The Menominee Indian Tribe was affected in a variety of ways, but I don't think any of them are unique to what any of you are facing in your own areas. The key point was to still try to provide employment at the same time providing safety to our members and the services that they depend on. The biggest impact occurred to our healthcare delivery system. We were very fortunate in that our healthcare delivery system had a watch that they received, and they started organizing in January and created a communication plan that also included reaching out to the tribal leadership. The other impacts that occurred were, of course, same as everybody else, economics, technology, and services to our members. We are a very rural reservation, and internet access is very limited. Computer access is very limited. And I'm sorry, not all our members have smartphones. They have the old kind where you dial up and you buy minutes. And with the technology changes that have been changed for people, a lot of people were using their minutes just simply trying to get unemployment compensation. So that's been a barrier to us. We've done some things that I'll mention later that trying to improve that service for our members. The economics, the closing of our casino, which is our main revenue generator, and the closing for our Menominee Mills for forestry operations that provide a great deal of employment for our members and for benefits, specifically insurance. The services to our members was also key because, like I said, we're very rural and there's a dependence on certain aspects that we do, from something as simple as that the people can apply for their licensing for their plates, but other people depend on us for food service for our elders and for our children. And, so there's a wide range, and even to the health care, because they started screening just for COVID. The barriers that, like I mentioned, regarding technology, as we've been working with our governor, he's been trying with his secretaries to improve some of that, but it's still very difficult when individuals haven't received any level of unemployment for about 4 weeks. We tried to keep people employed as long as possible. Our first layoff is occurring for the tribal government effective today. And that's about 80 individuals, considering we employ over 800 for our tribal governmental structure. But our casino was deeper. It was 400 individuals laid off there. And for our mill operations, it was well over 250 people. So there's a reliance on that income. And when it stops, it has a very detriment to our members, who are very proud and do not want to accept a lot of the services that we still tried to provide during this pandemic. You try to get members to go to the food bank. They're interested in relying on themselves, but appreciatively, they are going to it. The other thing that comes into play, like I mentioned, is how we can ensure the safety of not just our elders, but our children. And one of the things I think that impacted us to some level is when people said this doesn't affect younger people, that these are okay. But they didn't think about, yes, it does affect younger people. Yes, it predominantly did affect that age group. And they, when in turn, tried to do things for their elders, and that increased the risk for that population. And that was a barrier that impacted us. If I look at the strategies that our government worked with, um, I think one of the things that came to mind right away for us is that generally we're not dealing with pandemic issues up here. We all were part of, and I was part of, the influenza A and the swine flu, the H2N2, and that was such a gradual process it almost got boring as you were trying to arrange for the pandemic. We deal with blowdowns because that happen in our forests that affect the utilities, occasional minor flooding, and an occasional tornado. But those are things that don't have the impact, even though they're large. They don't. We've been fortunate it hasn't hit residential, but they don't impact you to the quickness and rapid response that we needed to do for this pandemic. Like I mentioned, our health clinic ended up getting the information on a watch list. They started organizing down there and doing what they could to reach just the incidence of COVID, but we struggled with testing, just like every other nation. On March 12th, we did a state of emergency, and we instituted our incident command structure with 8 directives. At that meeting, our legislature, which is our governing body of our tribe, came out and helped formulate the directives for the incident command that they could plan off of. And it was with immediate precautions and any future for if there was positive in our adjoining counties and positive on the reservation. So each one had, with those directives, there was different things that occurred. Some things as easy as travel restrictions, which we did. There was no travel. We did not limit our members from going off the reservation, because we only have one small grocery store here. And our members needed to travel to Shawano, which is about 10 miles from us, and to secure those services, essential food products and other things. So it was difficult, but with the people who came in and established our food bank, we wanted to ensure that even if we restricted travel and you didn't have the funds to go get food, we had the food bank established, and those people were wonderful in getting what our members needed. So with that incident command, like I said, it went from travel restrictions or food service to the food bank. We instituted a curfew from 10 p.m. to 6 a.m. That was later. And we also kind of took over our newspaper and asked them to be our command center for information to our community. So that's what our newspaper isn't being published, but they provide daily, very polished and professional information out to our members. And we also just recently, because of the technology issues, our community police officers are doing door drops. And we also do information stuffings in the meals we provide to our seniors, and also to our students and school children from Head Start, daycare, all the way up to our college level. So they all get information stuffings in there on a daily basis, so they know what exactly is going on. Our administration was very key in keeping the essential and non-essential people identified so that we could keep people employed as long as possible. We're not a rich tribe, and we have over 9,000 members, but we, just like I said, we were able to keep a lot of people employed until this Friday. And right now we're looking at a short furlough of about a month, and hopefully we can get those people back. We're working with other tribes in reference to our casino, which is doing a concerted effort for all of the casinos in Wisconsin so that we can all plan accordingly as to when we can do that rollout safely, not just for our employees, but for our patrons, which will be key. Those strategies have worked for us. The curfew, I think when we did the curfew, I think that it was a tool that helped instill to our members that this is serious, that we want to restrict the traffic. We want people to be home and stay home. Being a rural area, sometimes the best activity you can do is take a drive in the woods or take a drive around town to see what's going on. But we couldn't allow that to happen. Most of the convenience stores, there's about 4 convenience stores closed at 8 p.m., which we appreciated. But traffic was enforced, or the curfew was enforced by our police force. We're a non-280 tribe, so we have our own police force. And we had cooperation from the county that also shares some of our borders to instill a curfew. And we didn't want to use it as a hammer, but the importance of it. And I think since we instituted as of April 6th, we've only had 1 citation. So our members are following it and abiding by it. And I think it just helped instill in them the seriousness of what we were dealing with. And I think that as I wrap up, I believe that the strategies that worked for us specifically is the immediate installment of the incident command system with 8 designated work groups. There's a few members of the legislature on there, not because they're legislatures, but because they have vast experience in incident command. And so they're involved. We have our doctor, who's the director of our clinic, who is the public health official, our emergency manager, who's the coordinator, along with a backup coordinator for him, and our information person who makes sure that every informational item that's talked about at the briefing or new things coming aboard are made out professionally and polished and given to our community members. So instilling that incident command really helped, and it took a lot of pressure off me as the go-to person for the answers, because that's just one phase of what any chairman needs to deal with. And so having that in place for me, and I attend the daily briefings and I can interact with them, I know these people got it. They are very polished, they're very professional in what they do, and they're moving forward very succinctly together for the welfare of our tribe. I think that the other thing that helped during the incident command is that in meeting with our legislature, we went through some of their directives and we created more, and that became the baseline for them to move in the direction that we wanted them to, and that allowed them to create objectives for everything to see how they could move and assign people to them. I think the open communication is key. I think even though some of our buildings are closed, there was a semblance of our governmental structure in place. I've been here every day. There's steps taken to ensure not just my safety, but the safety of all the employees. And I think they all appreciate that. And I think that one thing I can't say enough is the capabilities. And this lady came from with a military background, who instilled our food bank, so people didn't have to panic if they didn't have food. There was some place they could go either for a hot meal, cold meal, or whatever they needed for that day. And the numbers are there for them for whatever food, whether they want something for a specific menu that day or whatever. And it's open, and they coordinate with our Menominee Union School District, who gives the meals to the children. They coordinate with our tribal school, who gives meals to the children in our Neopit community, which is about 12 miles away from Kashina. So I can't say enough of how well the incident command structure and the people involved worked for us and still continue to work for us. We have not had any tribal member within our borders test positive. We had one person from what we consider our Legend Lake area, which is predominantly non-native, test positive, a 96-year-old gentleman who had a mild case and who is fully recovered. But there's been no other positives within our reservation border, and I can't think of myself as being more fortunate for that, and that our members are clearly following the social distancing, washing your hands, and being conscious of who they approach. Masks are a thing every day. I have one on my desk. We have the alcohol that for any contacts that occur, and we're doing a lot of video conferencing, which in some cases I like that we can still do that, but I hate that it limits the membership interaction. But we try to do what we can, and we're setting up as we go forward where there will be call-in numbers for our membership to reach out to all our committees. So I thank you for this opportunity. And if anyone has any questions, I'm willing to answer as best as I can.
Thank you, Chairwoman. Thank you for sharing about making sure that there's unity and a unified approach within your tribal government during this time, because you can lean on everyone's strengths by going that direction. And I know that you have an important commitment today. So if you don't mind, we'll go ahead and just go straight into some questions for you. The first question that we have is, you have been working closely with the Stockbridge-Munsee tribe on COVID-19 response. How are you partnering with them? And can you speak specifically about your joint statement to the state of Wisconsin's plan to reopen the state?
We have a very good working relationship with all of the tribes within the state of Wisconsin. There's 11 of them. We do the conference calling, but before even this, it was a good relationship. We partnered with Stockbridge. My father was a full-blood Stockbridge member, but my mother insisted, well, you're going to be on the role that I bore you with. So there's that connection. They're a great tribe to work with. So are all the other ones. We have conferences weekly with the government. The governor, they're all on it. We have our MAST, which is the organization for, and Glitzy for our other tribes to connect with. And so there's a lot of open communication, and this is not my first go around. I've been involved with the legislature for over 15 years, since 2003. And so I've been around, and I know all of the parties that are involved with the different tribes. Even though you may have changes within your governmental structure, they're not always complete. So you still have people who you can connect to. And in reference to the joining of the statement, that's not unusual for us in Stockbridge to do that.
Thank you. We do have one more question for you. How is Menominee helping its members understand the CARES Act stimulus checks, and how is it helping newly unemployed members to seek unemployment relief?
What we did in reference to unemployment is because the Job Service Center was closed and we only have one on the reservation, our College of Menominee Nation staff assists a number of those individuals with one-on-one as that they can. We have allowed them to come up there and access the computers. We've allowed our employees that we've laid off to come in and use their computers in the offices. And we worked with the governor and his secretary of Department of Workforce Development to say, look, these are the problems we are encountering. We need some assistance or some changes in that process. I wish it was very worked forward to a better solution, but we still have individuals who haven't gotten unemployment for about 4 weeks. And that's a problem. And for individuals, we have a lot of members who don't have banking accounts. We work with our banks, specifically one who has come up and said that he would agree to create those accounts for people to access and get their stimulus checks and get a complete withdrawal and close that account. So the communication channels and just the working together has really helped us so that individuals can get their stimulus checks if they have no banking or if they have not filed their taxes. So our finance department has been working with that also, and our administration. But the college has rolled out a number of things up there for individuals. In fact, they've helped over 250 people sign up for unemployment.
That's fantastic. Thank you so much for sharing your story with us today. Thank you for your time, and everyone, Chairwoman Delabrew.
Thank you, and I appreciate the opportunity. And I have a legislator meeting. That's why I'm off early, and I thank the other chairmen and vice chairmen for acquiescing to my needs to attend a legislature meeting. Thank you.
Thank you. Next, we have the Shinnecock Indian Nation's Vice Chairman of the Council of Trustees, Lance Gumbs. Vice Chairman Gumbs, go ahead.
Kui, thank you for having me on. Can you hear me?
Yes, we can.
Great. As most of you know, if you've been watching the news, New York is really the epicenter of this virus, and it has been a nightmare in trying to deal with all of the nuances that have come down from it. The Shinnecock Nation, we are a tribe. We're the closest federal tribe to New York City. We're on the east end of Long Island. We are a peninsula surrounded on three sides by water, and surrounding us is some of the most wealthiest people in the United States and in this country, and probably some in the world. And what has happened around our community is that most of the city people who have their large summer homes out here in the Hamptons, where we are, have come out here, and with that, they've brought a lot of the virus out here. Where we're located, my community is located, we're in the second largest population of positive people for the virus in the state of New York, second only to New York City itself. So we've been really going through a lot out here and trying to protect our people and to make sure that we trying not to bring the virus back into our community. So with that, we implemented a number of policies in closing our basketball courts, our parks. We closed our beaches. We've implemented all of the social distancing programs that are out there, including, washing your hands, staying the 6 feet apart from one another. We have provided all of our tribal members with masks and hand sanitizers to keep hopefully to keep this virus out of our community. We've shut down all of our tribal offices. We did cleansing of all of the tribal offices. We're still doing it, even though we're not using them. We're doing it on a weekly basis because of those individuals that have to go in sometimes and in and out. So we're making sure that we do that on a regular basis. One of the big things that we did, though, which I think has helped, after we declared our state of emergency at the beginning of March, when we saw this influx of people and we saw the numbers here in New York starting to spike, we implemented this food tent that they're talking about. We didn't want to do it inside of a building, so we set up a large tent in front of our tribal offices, and we have been distributing food on a daily basis, Monday through Friday, to all of our tribal members. These are meals that you can cook, and they're actually pretty good too. They're not like the commodity meals. These actually have some flavor to them and stuff. So that is something that we felt very strongly about for two reasons. Obviously, one is, we have a lot of tribal members that now are unemployed, and so they're having to, survive. We have not, a lot of them have not gotten the stimulus money yet or unemployment benefits. So for us, it was a matter of, survival, and we took it very seriously in trying to feed our people. So that was one aspect of it. But the secondary part of that and why we did the food tent was to prevent as many people as possible from going off res. The grocery stores that we have here were inundated by all of our city residents. They cleaned out the shelves, and as a precautionary measure, they were walking in the stores without a care, no masks and everything like that. So for us, it was imperative that we try to keep as many people from going off res as possible. And that I believe that has worked in our favor. I think that has really worked out well in terms of limiting the exposure that our people have had. The next thing that we did was we shut down all of our tribal roads. There are 3 main roads that go in and out of our community, and we shut those down and allowed only essential personnel, ambulances or fire department, but we basically shut it all down to, again, prevent this influx of the disease coming or the virus coming into our community. So the 3 main areas that we feel were really successful for us was the implementing of the social distancing at an early part of this, right in the beginning, in the early stages, shutting down all of the recreational facilities and making sure that no large gatherings was held in the community. the closure of our roads and access to the community. And again, by far the most beneficial right now to us is the establishment of our food tent and the food distribution. And then in terms of, making sure that our community was aware of everything that is going on, we do live broadcasts, and we do them over Facebook Live. We do them over our Vimco, and we do them, we hit every one of our social pages that the tribe has, along with our, it's called Shinnecock Nation's Voice, to inform all of our community members of what is going on. I think the biggest success that we've had, obviously, is with the Facebook Live, because what we wanted to do was reach all of our young people, and all of them are on Facebook Live. So we were able to reach the majority, if not all, of our young folks in the community, to be able to, give them the warning of what was going on, give them the understanding of the seriousness of this, and to implore them to, to do these social distancing, washing their hands, and all of that. So we have these live broadcasts and update all of our community members. And I think that has, been a tremendous help. It didn't make it into my PowerPoint, but that was one of the big things that we did that has, I think it's brought the community together too. So, we have a lot of our individuals. Our oldest tribal member is 102 years old. My mother is 99. So we have a very, very large population of elders. And, as has been said a number of times throughout Indian country, they are our national treasure. So it was, our duty as leaders to try and protect these individuals in their 80s, 90s, and 100s. And so that's one of the things that, we've really keyed in on. We have all of the testing equipment now. We have the Abbott ID Now tester. So we are testing those individuals and making sure that those who have come in contact with the virusing, we have implemented the tracing part of the procedures. So we do have people that have the virus. Right now we have 4 confirmed cases in the community. We have had 3 deaths. One of those is in a nursing home, and then 2 from inside the community. So, we are taking this extremely seriously. And it may not sound like a lot, but, per our numbers, that is a lot for our community. So we're trying to do the best we can in terms of keeping everyone safe. I think that's the key factor. And I think all of the tribal leaders throughout the country, I mean, that's their number one goal, is to try to keep, all of our tribal members safe. And for our community, being in this epicenter, it is a real challenge for us. So we've, implemented, as I said, the testing. We have getting ready to now do drive-up testing, where people can just drive up and be tested, not only with the Abbott, which is a 15-minute test, but we're also doing the antibody test as well. We'll be doing that one soon to make sure that those individuals who possibly had it, we can now trace those individuals and who they've talked to in the community. So we're doing everything that we can possibly humanly do within our own strength. And, the biggest thing that we're doing right now is just praying, that we can manage to keep it out, especially with, the numbers that are surrounding us. Every day, even though the numbers have gone down here in New York, they're still admitting, over 1,000 people a day to the hospitals. And here in Suffolk County, those numbers are, just off the chart. So I greatly appreciate you allowing me to come on and, have these few minutes to talk about what we're doing, and, just hearing what, other tribal leaders are doing to hopefully implement some of the things that they may be doing that we haven't thought of. So with that, I thank you very much for having me on. And if there's any questions, I do have to get back to the tent. We had a large order of produce come in today, so we're trying to get all of that out to our tribal members. And one of the things I didn't mention with that food the distribution is that we actually are delivering it to all of the elders' homes. So we actually box up everything and then have a delivery to their homes so that they don't have to come out. Again, trying to prevent anyone from getting to our elders. So that's a big factor as well, is the home delivery that we have implemented. So with that, I thank you for having me on. And if there are any questions, I'd be happy to answer. Otherwise, I have to exit the stage left and get back down to this tent.
We have Chairman Joe James of the Yurok tribe. Chairman James.
All right. Good morning or good afternoon. First of all, thank you for this opportunity to tell our Yurok story. Before I get too much into it, the Yurok tribe has been very active and proactive in dealing with this pandemic. We can see it coming in coming our directions. Really, how we took on this is really approach the strategic approach that we did to protect the safety and welfare of our tribal citizens is really take it from that shared and cultural values of who we are as Yurok people. Myself, as being a traditional ceremonial leader, as also and having the privilege to be the tribal chairman of the Yurok tribe, we were able to bring those cultural values into place and really attack this pandemic from a Yurok village perspective. It's nothing new that indigenous people across the world have fought against illness since time, but we welcome this in the best way we could to depict the safety and welfare of our citizens from the mindset as fight medicine with medicine. And what I mean by that from us is through prayer, through everybody coming together from a grassroots effort, from a government standpoint. So I'm really proud of our community, our tribal citizens, our council in our approach in this. I'd like to get into it of how the COVID has impacted the Yurok tribe. Nearly 90% of our tribal government are working from home. Tribal citizens, we have limited access on our upper reservation, so it has impacted us greatly and has made it difficult to get information. So we've been using door-to-door checks, using social media, using sandwiches boards, those things to get out there. So it has definitely impacted us greatly. We had to close our Red Hotel Casino, our economic businesses on the reservation, which employ a lot of tribal citizens here back at home. And those enterprises were primarily a seasonal business here. So it's impacted not just the tribal government, but we also have tribal entrepreneurs that it's greatly impacted. Also, we were looking to launch a new Yurok Redwood canoe tour business. We've always used our canoe tours in our ceremony, in our way of life. That was our modes of transportation on the river. And now we were in the process of starting that Redwood canoe tour, ecotourism business that have provided jobs, that have promoted our lifestyle, our identity, things like that. So that has impacted us greatly. We are working with our local school districts to assist the Yurok students who are distant learning. As I mentioned earlier, many of our citizens do not have access to cell phone service. Just a couple of years ago, we just got power on our upper part of the reservation. So a lot of discussion is being talked about telemed. That's great. I think those are all great discussions and resources that we need. But at the same time, we're dealing with real time, real life, the obstacles this COVID has flushed out, and it's flushed out in a good way because it's identified our gaps, and we have come together as a one to identify those holes and looking to improve ourselves. We've been working with the United Health Service as our primary health provider. They're also limited in terms of infrastructure and testing facilities. It has impacted us regarding participation in our culture and religious practices. We've been doing that since time, but we've got to do that in a social distance and a physical distance. But it is playing a key part in impacting us as ceremonial people and as the government agency of the Yurok tribe. We have a great buy-in from our people regarding the physical distance and shelter in place. We have hundreds of examples of our citizens helping each other. And I'll go back to that. It's from a Yurok cultural mindset, all hands on deck to help our people. What strategies have we deployed to respond to the pandemic? I think the best thing that we could have done was implement our Yurok OES system. As it mentioned earlier from our tribal leaders talked about it, that was the best thing to do, to implement right away. We created a number of task force that we put into place. Part of that task force was a Health and Human Services task force. We also included an education task force, a grants task force, and we also created a team of food distribution. So we're able to provide food to our elders that live on a reservation, also in our service area. Service area for us, we live in Northern California, Klamath River, which includes Humboldt and Del Norte and Trinity County. But when we first started, it's always been, let's make sure no elder gets left behind. And it wasn't just the food box, it was the spirit and what was meant behind that. And it was important for us to reach out to our elders that live out of the state of California, that live across the nation. We were able to put together a $50 a check to provide to them, knowing that we couldn't provide food boxes to them. So it was important for us to make sure we identify where they're located at, and it was important for us to reach out to them. And again, it's a spirit and identity of who we are as Yurok people. One of the things that was key also, we too issued a shelter in place. We declared a state of emergency. We closed our reservation. We implemented a curfew. We implemented operations of a food serving business to be altered to safeguard our staff. We limited our C-store gas stations we have on a lower and upper part of the reservation. We put best practices and measures in place to make sure our employees are safe, our tribe members are safe, and our community members are safe. So those things that we did. If we can go to the next slide. The tribe has been very, very active. We've been partnering with nonprofits. We're receiving funding from them. I want to thank them for helping us, because it is a team effort. And regarding resources, we're a heavily grant-funded tribe located in 2 counties that I mentioned, and so we appreciate the opportunities that nonprofits provided us, so we can bring additional resources to our community. We also we pushed to help our struggling families to sign up for existing services, such as the Yurok food distribution program. This food program provides 30-day food supply for our families. We're also working with our local Office of Emergency Service in Humboldt and Del Norte County. We're working with our local law enforcement. We're partnering with our Office of Emergency Services. We're also talking to our congressmen, our California Assembly members. We're staying engaged with our governors and their staff regarding that. The Yurok tribe has also created a Office of Emergency hotline for our tribal citizens to call regarding anything, issues that they might be dealing with on a day-to-day. The tribe is also is preparing to perform contract tracing investigation and is advocating for additional testing supplies on our reservation. If we can go to the next slide, please. So what is the best strategy to work particularly well for us? And for us, it was that mindset, as I mentioned earlier. Take care of each other. pick each other up, love one another. This is the time, and I'll get back to that. We knew this virus was coming, so the Yurok tribe was very active in not just for us as prayer people, as government people, but also as our Yurok medicine. Let's put that on the table. And let's have our people step up and combat this virus. And so we delivered to make sure food was delivered to our elders. As I mentioned, we declared that state of emergency. We made sure we, as part of closing down our reservation, we needed to make sure to provide food and resources to our people that are living on the reservation, because we also put that curfew, and so we really wanted them to shelter at home in that place. And so it's those are things that were working well for us, and our community has bought into it, and they're very supportive of it, and it's been working really well for us. I can go to the next slide. We've been operating our government on a limited basis. I say 90% of our tribal employees are working from home. I have approximately about 100 tribal employees working on the front lines, ranging from telephone services, delivering goods, dealing with normal government businesses, dealing with the OES system, dealing with lots of tribal members that are going through tough times. And so it's been very difficult, but we continue to keep our government going to make sure we're there to assist and help out our tribal citizens. We are currently working on a plan to reopen. We're following the CDC guidelines. We're aware of we're very rural and isolated. Each area is different regarding population. So for us, regarding reopening, number one is the safety. Is the safety of our tribal citizens. That's the number one goal and priority for us. We are being greatly impacted for our services, for our financial services, for economic services, and our tribal members are suffering from their economic businesses. But there is going to be a time when we do open up, and it's going to be from the mindset of how we started as Yurok people, from a Yurok village mindset. So I wanted to thank everybody for their time, for allowing me on here today to tell our story. At the same time, this is opportunity too. We created a grants task force. We're following the CARES funding that's coming down. On one hand, we're dealing with the virus. On the other, we're managing our government. And at the same time, we're looking at the opportunity that our tribe can benefit from. We look at it as we want help, but at the same time, you got to have that mindset. Help ain't coming. It's our job as tribal leaders to look out for our tribal government and our people. And so, but I want to thank everybody for allowing me to tell our story, and we look forward to hearing from others walk by.
Thank you, Chairman James. It sounds like you're definitely keeping your citizens first and prioritizing the most vulnerable. So we appreciate you sharing your story today. Governor of the Pueblo of Pojoaque, Governor Talachi, go ahead.
All right, first I want to commend the both chairmen and the vice chairman for doing such a great job in protecting their people and working so hard to make sure that their people stay healthy. This has definitely been a challenging time for everyone. You know, it was a tough call at the beginning to start shutting things down. Initially, we were kind of following it on the news, making sure that we were prepared. And so a few weeks before we initially shut down, we did come up and sit down and try to come up with a plan in order to, in anticipation of the shutdown. Early on, it was a balance between creating a healthy fear and not creating too much fear where there was complete panic. I'm fortunate enough to be surrounded with quite a professional group of individuals that have helped out, up to and including our chief of police, our captain, and we just recently hired an emergency manager to help out in this situation. I'm fortunate enough to have had a background in law enforcement. I served in law enforcement prior to getting into law leadership. So our initial response was to shut down all non-essential practices and government entities within the tribe early on in mid-March, I'm sorry. That included closing down our wellness center, closing down our governmental services area. And so we saw the specific challenges early on, which were food delivery, groceries for our seniors, childcare, and other things. Initially, we set up an emergency operations center at our police department and began to run not only the tribal operations, but the food distribution and everything else out of that police department. After a while, we began to realize, well, hey, this is going to start affecting our businesses. We have one of the largest casinos in northern New Mexico currently. We have 395 rooms, a large gaming floor, up to 800 machines at any given time. And so what we realized is that the tremendous impact it could have on the community to continue to stay operational. So, our initial response was based solely on the tribal community, our people, and making sure that they were taken care of and fed. We did implement a Meals on Wheels program, a grocery delivery program, and food distributions for not only our elders, but our youth as well. We also have a grocery store, which was, as the vice chairman had mentioned, we began seeing supply shortages almost immediately, and the local community, non-tribal community, started packing the stores. It was definitely challenging, and for about 2-3 days in a row, I myself was there helping to stock groceries. And I'll tell you what, I have a newfound respect for those stocking groceries and for all those working so hard to protect us, all of our frontline employees. It was important for me to make sure that I'm not asking my people to do anything that I wasn't willing to do myself. So I myself have worked for darn near 5 weeks straight without a day off, including weekends. But I'll tell you what, to see the amount of people come together, the passion and the want to help other people is a pretty amazing experience. As we move forward with shutting down the government, I received a call from the governor of the state of New Mexico asking if we'd be willing to use our resort as a self-isolation / quarantine facility. There was initial hesitation, but I said, what better thing can we do? We've always said here in the Pueblo that we put principles before personalities. And if there's the right thing to do, we're going to do it. We definitely don't believe in leaving anyone behind, and we definitely don't shoot our wounded. And so the Pueblo and my council supported the decision to go ahead and open the facility up to help those that are in critical need. Here in New Mexico, we have approximately 3,213 cases of the COVID virus, with 112 of those being deaths. The unfortunate circumstances here in New Mexico are that of those 3,213 people, over 40% of them are natives from our surrounding pueblos, specifically the southern pueblos that are near the Albuquerque area and those areas, and the Navajo Nation. With that being said, we saw the impact it was having there, and we wanted to do our best to open up our facilities to these individuals. And so we did commit to opening up the resort. We have 395 rooms. We were able to isolate each different wing. We have 2 wings, the A wing and B wing, and we were able to isolate them so that there is no cross-contamination or the opportunity for the infection to spread. Initially, the conversation was to take in individuals who were living in households of those with COVID positive. That quickly changed, and we've had to adapt and overcome as we've moved forward, and have opened the facilities up to those who are COVID positive as well. mainly those who are lower risk and have the ability to self-care. The ability to communicate effectively with our federal, state, county, and local partners and tribal partners was critical to making this thing a success so far. Making sure that we got the correct PPE. My number one priority was making sure that our tribal members and my employees are protected. And so that was one of the conditions that was set early on. Luckily, the state did come through. National Guard came through with enough personal protective equipment to help us out. And thus far, we've been able to help quite a few people recover and be discharged. And currently, we have close to 60 individuals here at the resort, and they are continuing to come in as we speak. We did move our emergency operations center from the police department here to Buffalo Thunder and make sure that we were doing everything possible. We have limited people working on these specific initiatives, so it was important that we be as efficient and effective as possible in helping making sure not only our tribe was protected, but our guests that we were bringing in from other tribes, that they are protected as well. We currently have about 6, 7, I would say 7 or 8 tribes that are represented here at the resort. We've reached out and communicated with all of our pueblos here in New Mexico to reach out and give whatever resources we can. We are in a centralized location here in New Mexico, just north of Santa Fe. And so we're an ideal location to help send people our way with an ideal facility. So it has definitely been a learning experience. And I'm sure that if you talk to any tribal leader, there is no written handbook for this. There is no procedures or protocol for a response of this nature. And so we've had to kind of write the handbook ourselves as we're moving forward. Our ability to adapt and overcome is critical to making sure that we're being effective in what we're doing. So here in the Pueblo, it's been quite the challenge having not only the responsibility of our tribe, but also the responsibility of our guests. But I'll tell you what, I've got a team that has stepped up and done a great job. One of the things to think about in our tribes is that we still survive today, and resilience is in our nature. Resilience has become who we are. Our mindset from the very beginning was that our ability to adapt and change quickly is going to be what is going to be the difference between life and death for many. So all of us took that very serious, and I have a group of individuals working here at our Emergency Operations Center, working 24/7, making sure that we're adapting to every change and condition that comes our way. Currently, the Pueblo of Pewaukee has no cases of the COVID virus. Santa Fe County has been lower on the scale with regards to the positive cases. Currently, I believe there's 98 confirmed cases with I believe 3 or 4 deaths here in the county. Early on, we got a lot of pushback and worry from some of the tribes and the tribal members in the area saying, well, we don't have any cases. Why would we be bringing in individuals who are positive or who may have the disease? And my explanation to them is that we carry the same mindset to the broader scale of things that we do have in the tribe, which is we don't leave anyone behind. It's been quite the challenge to keep up communication between the FEMA and state government, but altogether, I would say that we're operating and we're popping on all cylinders. We've developed a combat rhythm that has helped us maintain our operations. We've built efficiencies in places that we didn't even know existed. We've been very effective at responding to every issue that has come up. We made the decision as well that any non-essential personnel would be sent home. Up to this date, we're still paying our employees, both on the government side and on the corporate side. Again, sticking with the mindset of no one gets left behind. Now, it is a painful thing to have to do that. However, we were grateful for the Paycheck Protection Plan that came through in the CARES Act. We submitted applications not only for non-gaming enterprises, but for our gaming enterprises as well. And to date, we've had several successes in that, therefore helps offset some of the economic strain that we've incurred because of this. We're grateful for those who have helped, especially our state partners who have come through. Currently, we have medical staff on site helping out, helping us care for these our guests, the ones coming from other tribes. It has been very difficult to make sure that we're doing what's right in order to take care of our guests. We do have sick individuals who have come, individuals that are having pretty heavy symptoms, but we've been able to adapt and change and get the resources that we need from our Department of Health and other areas to help us out. We did shut down the Pueblo early on. It was critical for us to make that decision. When I looked at the overall situations coming in from the West Coast and the East Coast, I wanted to take an early step and make sure that we were proactive and got ahead of the virus before it hit. And so we early on shut the Pueblo down, meaning we placed police vehicles and checkpoints at the main housing areas. Fortunately, we're a small enough tribe geographically that we could do that. And thus far, it's worked out pretty good. And again, we've had 0 cases. We've had some close calls, but we have 0 cases. But again, I do want to commend all of the tribal members or tribal people and tribal leaders who are in this specific situation. I know that not many of us signed up to be in this type of situation, but the responses that I've seen in Indian country are amazing. The heart and the passion and their ability to change and react and take proactive stances as well with regards to this virus has been truly amazing. And I'm just honored and privileged to be a part of it. As I've said with any other Pueblo in our area, if we can be of any assistance, if there is models that we have developed that can be used in other situations, in other states and other tribes, by all means, I will leave my contact info and reach out to us. We can tell you exactly what we're doing and how we're doing it. So,
thank you very much, Governor Talachi. And you touched on something very important. You said resilience and adaptability, and that's something that all of you leaders have demonstrated to us today. So hopefully some of these best practices can be adopted by other tribal nations. We are a little bit short on time here, so I believe we have time for 1 to 2 questions. So I'm going to go ahead and start with the first one. This one is to both of you, and we'll start with Chairman Joe James. Chairman, do you feel there's enough information available for tribes on the resources that became available under recent congressional packages and how to obtain those resources?
I think there's not enough resources. As we know, as an Indian country, it's very difficult, but at the same time, we understand those challenges and we deal with them. I think things could be better streamlined. We're working well with FEMA, but there's hurdles that we have to go through. And I think we need to get to. And I know this is a global pandemic, so everybody's stretched thin. So we got to understand that and keep that in mind. But at the same time, for us, I think as being a rural and isolated area, as I mentioned, we just got electricity. Resources are tough to come by and hard to get sometimes. But that doesn't mean we stop asking or quit advocating, quit fighting for those on behalf of our people. And so I think it could be improved. As I mentioned, we took this battle. As I mentioned, this analogy is we're carrying that Yurok flag up the hill. And it was a very difficult hill, day by day. And now we're on top of the ridge and walking that ridge, whether we're picking acorns or looking down. but it's we're flattened out, but doesn't mean the resources stop or the help stops. It just means that we adapted and changed to it, and now we're walking through it. So, but yeah, I think the resources and the communication could be strengthened, to put it lightly.
Thank you. Governor Talachi, do you have anything to add to that? Went on mute.
Sorry about that. I was talking to myself. Early on, we were a little overwhelmed with some of the information coming out. It was very difficult to figure out how we navigate all of the systems and the grant opportunities coming out. One of the things that we did implement was put on our website a resource page so that everyone, not just ourselves, could tap into these resources. And so that's been helpful in consolidating the information. I think that's been the biggest challenge, is that you've got multiple agencies, multiple providers giving resources, identifying them, and consolidating all that information and not becoming overwhelmed has been really challenging. But as of right now, as several of the tribal, or a couple of the tribal leaders had mentioned, having a task force and a grants team is absolutely critical, so that they can start identifying what is and what isn't worth going after. I know all of the information started coming to myself as a tribal leader, and after a while I just became overwhelmed, and so I was able to hand off a lot of the information, a lot of the applications out to our grants task force, and make sure that they were applying for what we needed to do. One of the challenges as well is that the CARES Act covers not only governments but businesses, and so the unique position of tribes is that we typically operate both governments and businesses under one umbrella. And so to separate those things and try and navigate that has been a challenge, but it's about organizing our businesses and making sure that they're applying for the Paycheck Protection Program, and our government side applying for the correct grants. We've had one association, the All Public Council of Governors, who has put together a condensed version of what resources are out there. So we've been incredibly grateful for that. And if, again, any tribes need that information, we're willing to get that out as well.
Thank you so much, Governor. And with that, that's all the time that we have for today. So I just want to extend an additional thanks to you all for taking the time away from serving your nations to be here with us today. Thank you to Chairwoman Delabrew, Vice Chairman Lance Gumbs, Chairman James, Governor Talachi. That's the time we have for today. So for our audience, if we were unable to get to your question, please email them to ncaipress@ncai.org, and we'll make sure that we get those filtered over to the correct person. Please stay tuned for upcoming announcements on the next installment of our Tribal Governments in Action Forum series. And as a special announcement, our president, Fawn Sharp, NCAI's president Fawn Sharp, will speak tonight on the impacts of COVID-19, the economic impacts in the Native Americans in COVID-19 town hall with Illuminative. You can find the details on our social media. Our handle is @NCAI1944. And you can also find the latest information on NCAI's work around COVID-19 at ncai.org/COVID-19. And thank you all. Yaha.